under your back of your knee,
The cubital fossa,
the hand.
posterior side of the knee would be good enough.
Okay. And
That's good. Right there,
just take the knee, raise the knee, all the way up, no bouncing. Right?
correct. Now put that right hand on top of the knee. There you go. So you can press down the hip into a little bit further flexion. There you go.
Come back down, same thing.
Underneath support for gravity.
This is hip and knee flexion.
Hip and knee flexion combined, yes.
Okay.
Hip and knee flexion.
And then abduction and induction is off the back. As far as you can tolerate it. Place it back. Right? Then the ankle.
Let's do the ankle.
Check the bottoms to make sure it's not.
I hope that most of the time patients will have their shoes off, but yeah, you did the right thing. You want to have a little gum sitting underneath or
Yeah.
whatever else.
Sanitizer right over there.
Then you place your hand here. Like this. Put your hand right here. Push back. Or, like I said, you can go like this. Use your forearm. Go like that.
Good. All right, what else have we done to the hip or the knee?
The,
How about hip flexion only or hamstring stretch?
Okay, you got roll
No. Hip flexion.
Hip flexion.
Think
Straight up.
before
Right.
we act. That's a good thing to think about. Hip flexion. I would say, Cedric, on the test, why don't you show me hip flexion as you stand right there, Cedric? Show me hip flexion as you stand there.
Hip flexion.
Good. Okay. Why would you then want to move the leg backwards if you're moving it forward?
Because this is,
Or to do hip flexion.
um,
Just move her leg where we do hip flexion.
flexion and
Okay, yeah. You were trying to do extension.
yeah,
Okay,
extension.
we're going to do flexion.
Okay.
Alright, let's do flexion of the hip without bending the knee.
All is the same as the arm and the shoulder. Place your hand here and on the postal area of the knee. Straight up. Rotate the hand in front of the knee.
And create that hamstring stretch. And rip her jeans. There you go.
Back down.
Underneath. Good. Alright, this is then also called a hamstring stretch because you're stretching the hamstring. Alright, just out of curiosity, John, how often do we do a stretch and for how long do we hold it?
How often?
How
many
long do
times?
we hold it?
20 seconds.
20 to 30 seconds. And
20
how many repetitions do we do it?
10.
About 5 is enough.
5.
Okay, especially because you want to hold it 20 seconds.
Okay.
5 is good.
Okay.
10 you could do if you have a very tolerant patient. Okay, so if you do regular range of motion, and we're not really stretching, we're just moving back and forth, how many times do we do that?
Regular.
Yeah.
You can do that 10.
How many times 10?
3 sets.
2 to 3 sets of 10
2 to
for
3
range of
sets.
motion. Alright, we did one more on the hip. The one you wanted to do is called hip extension.
Oh yeah, you gotta go to the side. Move close to the edge. Take the fibula part of the leg.
And tibia, I hope so too. Okay, there's a fibula and a tibia in
Yeah.
there. Okay.
And put your knee right here. Let the leg rest on the forearm. Put your knee here. Put your hand right here below the hip, on the top of the hip. And push in and pull back.
Good technique, Sarah. Really do. Good.
My wife really enjoyed it.
Alright, good. Have we done anything else?
Transfers?
That's all the mobility, that's all the range of motions that we've done. Correct? Abduction, flexion, combined flexion, ankle dorsiflexion, and hip extension.
What about the moves?
Which moves?
The moves from the
Oh, yeah.
the
Transfer.
transfers?
Oh, transfers, yeah.